When I made the last video about let's learn the dentistry, I got many positive response that I should make such kind of videos. So today is the first video of the series of let's learn dentistry. In today's video, we're gonna cover how the checkups are done, how the pain treatments are done, what are the things you need to take care, how you receive the patient here in clinic, and what happens once the patient comes for checkup. Hello everyone, this is Dr. Swapnil Chandratre here. Everyone knows by now that in Germany the dentistry is controlled by the insurance system. How it is done by that? Well, here 80% of the people are government insured and 20% of the people are average private insured. What happens is these government insured people, they will receive one smart card, okay, with the chip, and there your all entire data of what is done and what has to be done is stored there, okay, and it is every clinic has their machine. Okay, so in that machine, when you scan that card, that data is automatically transferred to the insurance company. Okay, and they can see that when and where you were during which time. Okay, and what you have get returned. Now, how do they get to know? See, in insurance, when you go for a checkup, mostly the checkup thing is included in the insurance. I'm just talking about first the government insurance because that is the most thing which you are going to face. Twice in a year, a normal routine checkup is included in that insurance. Also, once in a year, a minor calculus removal of the tooth is included. Okay, so what happens is that when you go to the clinic, okay, first you go for a checkup as a new patient or regular checkup. They do everything checkup once in a year. As I said, they'll remove your calculus. Also, 80% of the clinics here have the OPG machines, okay, because OPG is also included in the insurance. Not every year, but when you go for as a new patient, then they will take your OPG. Okay, that OPG is valid mostly for 2 years of the time. Okay, they can renew this OPG in a 2 year time. Before that, if they want to do it, they need to show the reason that why they have make took another OPG. Okay, otherwise it is every 2 years what is required, what is not required, which it required sealings, which it require root canal treatment, this need to be removed and all that thing. Okay, and this will require flap surgeries and all that. So everything has been explained to you. Then depend on the clinics how much of the patient and how much time they have. Okay, they will start the process as fast as possible, or you get the new appointment to get this thing done and all that. That is individually clinic oriented, but this is the basic thing what they do. Yeah, calculus removal is included, but professional tooth cleaning, okay, that is not included. That is considered as a private behandlu. Okay, so some portion of the payment will receive by some of the government insurance. Okay, they will pay some part of it, the rest of you need to pay on your own. It is also considered as a standard practice here, the tooth cleaning once or twice in a year. People get it done very regularly. When the kids are in kita or in kindergarten, they are also taught about the tooth hygiene and awareness and all that. So many kids, as soon as they born, okay, and once the teeth are starting to come, their parents bring them here, okay, to do checkup. So that is also a very common practice here. A dentist here considered as a family dentist. Okay, so here you need to get registered under some dentist. It is not like that when you have a card, you go to one time in a one clinic, next time you go to other clinic, and it is not that common here. Here you have to be registered in one clinic with your insurance. Okay, and when you change the dentist, you need to show the proper reason that why you want to change. Of course you can change it, you need to show the proper reason that this is the reason you are not happy with it or what and what. You need to convince with other clinics that okay, this is the reason I want to come here, and they will take you. Most of the time the patient remains with you until and unless you have done any complication. So for example, if you say that you have the 1,000 patients, okay, then you need to keep in mind that average 70 to 80% patients will come regularly twice in a year for your regular checkup. Okay, so you can expect that much amount of money to be received and that much amount of patients to be there. Okay, that's a very good thing here in terms of awareness. So you don't need to be worried, and everything is also schedule based. Okay, so it doesn't works like that. Appointments are so planned that, for example, in you have one appointment in January, then you have one appointment in July and all that thing. The year wise it is been divided accordingly, so that you will get enough patients every time. Okay, and during the checkup, when you find anything, you anyway do the treatments accordingly. Okay, so that way you have all this time managed, you have managed the patients, and this work life balance has been managed. So if you want to go to vacations and all that thing, so during that time also it has been everything well divided. You don't need to worry about losing the patients. Okay, Now coming to the point is that what happens is, due to work life balance, okay, you are working Monday to Friday only. What happens if you have any emergency, any pain on weekends, and what will then patients do? There is a very good system here which is called as emergency duties. Okay, so how that works, for example, if you are living in one area, in that area there are 50 clinics, okay, and there are 50 weeks in a year. So it's like, every clinic has to work on one weekend. Okay, that clinic has been appointed during that time, so that clinic will decide that what are the OPD hours, for example 8 to 12 in the morning, or some do 9 to 12 or whatever. Okay, or during that OPD hours, any patient can come there from any clinic, okay, with their problem. For example, if you have pain after extraction, or if you get the RCT done recently and some swelling has happened, okay, or any tooth has started to move, or if you have fallen down and your tooth has come out or broken or something like that, all these emergencies you can go to the any clinic, okay, with your insurance card, that you can swipe it and get the emergency managed. Okay, they will not do your entire treatment. Okay, so for example, if it requires RCT, then they will do the trepanation and devitalization and put the medication, and the rest of the root canal treatment has been done by their own dentist. Okay, if tooth is mobile and it is removal, then they will remove it, and the replacement of the teeth has been done by their home dentist. This way, this system is very good that you can, it's not like that, you go for an emergency to some clinic, then that is their patient. Okay, so it is not like that. Your patient remains with you only that emergency doctor has maintained or helped you to cure that emergency. Okay, so this is a very good system. So in that scenario, you don't have to be worried about that, in weekend if you don't open it, then patients will go away to another clinic. Well, this kind of situation is not there. As I said, the patients remain loyal here, okay, and you don't have to be worried about losing the patient, including having less work or something like that. Those kind of scenarios will not happen here. In terms of Schmerzbehandlung, this pain therapy, everything is included in that, okay, in insurance. For example, tooth removal or trepanation, devitalization, or if you have a swelling and abscess, then the incision and removal of the abscess, everything has been is included in the insurance, because that is considered as a Pflicht in Germany. Okay, and emergency treatment has to be managed without any cost. That is a very good system, and that way you don't have to be worried any time that if you have any pain or any emergency, you don't have to be getting handled this situation. Okay, so this is all about the rough idea of how the checkup and how the diagnosis and all those things are done. One question will also arise, that why the patient will go regularly to do the checkups? Why do they have the motivation, even though it is included? Why they will do that? One more important thing is to remember that here the insurance system have one thing which is called as a stamps. Okay, so when you go for a yearly checkup, once in a year you will get the stamps. How the stamps are useful to you and how it is going to be useful and to the patients, those things we're going to discuss when we talk about the prosthetic part. Today part was just about the regular checkup and all that. In further video, I'll try to explain you the surgical and endodontic part, and then I'll talk about the prosthetic part. So please hit the subscribe button and hit the bell icon so you will not miss out on this important information. I hope that this video has given you a lot of information. Keep liking it and keep motivating other people. And if you have more questions, you can always contact me. The link is in the description box. Till then, have a nice day.